The Apgar score is a test given to newborns soon after birth. This test checks a baby's heart rate, muscle tone, and other signs to see if extra medical care or emergency care is needed. This test is usually performed at 1 minute, 5 minutes, and 10 minutes of life. It can be performed twice. It is a quick way to determine the baby's health and if they are in need of resuscitation. Apgar is an acronym formed from initial letters of specific words. A stands for appearance, which basically means skin color appearance. P stands for pulse, or the heart rate. G stands for Grimace, or the reflexes. The second A stands for activity, which basically refers to the muscle tone. And lastly, R stands for respiration, meaning the breathing rate and effort. Doctors, midwives, or nurses will evaluate the baby based on 5 categories and assign a score of between 0 and 2 for each category. Scores are between 10 and 0. 10 is the highest score possible, but few babies get it. The reason for this is that the majority of babies' hands and feet stay blue until they warm up. On the appearance of the skin color, a score of 0 is awarded if the appearance of the newborn baby is bluish-gray or pale all over. This includes both the extremities and the trunk. A score of 1 is awarded if the baby has a normal color appearance, but the hands and feet are bluish. A score of 2 is awarded if the baby has normal appearance of pink color all over, including both hands, feet, and trunk. A score of 0 is awarded if the pulse is absent. A score of 1 is awarded if the pulse is below 100 beats per minute, and 2 points is given if the pulse is normal, meaning it's above 100 beats per minute. On the Grimace, a score of 0 is awarded if there is no response to stimulation. If there is only facial movement on stimulation, a score of 1 point is given. If the baby pulls away, sneezes, coughs, or cries with stimulation, a maximum of 2 points is awarded. On assessing activity, or muscle tone, a score of 0 is given when there is no movement or when the baby has a floppy tone. When the arms and legs are flexed with little movement, 1 point is given. 2 points is given when there is active, spontaneous movement. When the baby is not breathing, a score of 0 point is given. If the breathing is slow or irregular and if there is a weak cry, 1 point is given. And a maximum of 2 points is given if the breathing is of normal rate and effort and if there is a good cry. It is widely recognized that a score of 7 to 10 is reassuring, 4 to 6 is moderately abnormal, and 0 to 3 is abnormal. Any score of lower than 7 should alert the medical practitioner to consider whether the baby requires any intervention. Perfectly healthy babies sometimes have a lower than usual score, especially in the first few minutes after birth. Many babies with low scores are healthy and do just fine after getting used to life outside the womb. A lower score does not necessarily indicate that your baby is sick. It implies that your baby might require emergency medical attention, such as airway suctioning or oxygen to improve breathing. And that's all for this video. If this video has been helpful, please give it a like, share it, and subscribe to our channel so that you don't miss out on our next video. Thank you for watching. Until next time.